Good afternoon, and welcome to another episode of CTLN Opinion Plus. As you know, and always, this is a space for our opinions and for the issues of Latino community. This week, we are joined by Martha Stone, the founder and executive director of the Center for Children's Advocacy. Thank you, Martha, and thank you for coming on to discuss such an important subject as children's advocacy.
Sure. Thanks for inviting me.
Can you give us a brief overview of the work the Center for Children's Advocacy does?
Sure. The Center is a nonprofit legal art organization. We have 12 attorneys, and we do work in the child abuse, juvenile justice, health, immigration, and homelessness field. I founded the organization myself. I was the only attorney about 22 years ago. And we do a number of kinds of advocacy: legal representation, legislative, systemic advocacy, and training of parents, professionals, and kids.
That's very impressive to have such such an important organization, and that it was founded by a woman. It's wonderful. But what you mentioned that one of the issues you advocate for is children's homelessness. In Connecticut, I think there is a huge contrast between the upper middle class and those living below poverty. What do you do to advocate for children that are homeless or are living at below poverty levels?
Well, Connecticut has it's the richest per capita state in the nation and has three of the poorest cities, right? Hartford, Newport, New Haven. And so we have offices in Hartford, Bridgeport, and New Haven. We have attorneys based in hospitals, Connecticut Children's, Yale, New Haven Hospital, Yale Child Study. And particularly for the homeless kids, we have a mobile legal van actually that we go out and reach kids where they're at. That was one of the founding principles, that I felt like we needed to bring the legal services to where the kids are. And so we advocate for homeless kids. There's sort of pre-COVID and post-COVID. Mm-hmm. So for the homeless kids, post-COVID, the two biggest issues are food insecurity and educational disengagement. So we've been really advocating on those particular two issues most forcefully in the last year.
I see on the side of your office you have a sign that says "Everybody deserves a voice."
Yeah.
Children are often spoken for by their parents. How do you step in to advocate for children whose parents otherwise wouldn't, or who need assistance?
Yeah, a lot of the kids we represent have no voice, right? Who's the lobby for kids at the legislature? There's no lobbyists for kids at the legislature. So we develop a lot of legislation. We write legislation, testify before the legislature. That's one way we give kids a voice. We represent a lot of abused and neglected kids. We are their attorneys. We are their voice. And the third way that we try to advocate and give kids a voice is we run three groups, particularly called Youth Speak groups. One of them is with the Center for Latino Progress. Another one is a juvenile justice group, and a third one are older kids who have been through the juvenile justice and child welfare systems. And we run these groups once a week, and the kids advocate for particular issues. And so we'll bring some of those kids to the legislature to testify for themselves. Because if kids have nobody to speak up for them, then they have to speak up for themselves.
How have you adjusted these programs to make them COVID safe and still effective?
Yeah, I mean, that's been the biggest challenge this year, right? So bad weather, we would meet the kids in the park. We would meet them socially distant in big rooms. After it got cold, we have Zoom meetings with the kids. It's not as good as seeing the kids in person. A lot of our lawyers are actually still going out into the community and meeting kids in their homes, because if we represent kids, particularly in the child welfare system, you need a relationship with the kids, and the only way you can get that is really seeing them in person. So masked, socially distanced, and we're almost like the first responders going out and seeing the kids in the community.
Um, you mentioned that you have one of your advocacy groups is lit, for Latino progress. Um, what has been the biggest issue in that group?
It's probably been the issue of the school disengagement, right? A lot of the kids in that group talk about low expectations by the teaching staff with remote learning. It used to be that the issue was Chromebooks and kids didn't have Chromebooks. Now we see Chromebooks that break, Chromebooks that aren't appropriate. The family will have one Chromebook, but they'll need, you know, Chromebooks for other kids, or they'll need Chromebooks for birth to three services. So the parent will borrow the educational Chromebook to get the services. Then we have connectivity issues because the connectivity for kids in the urban centers is not as good. So the kids drop off in the middle of class, or they're told that their connectivity isn't good enough, so they should just put their answers or questions in the chat. So it disengages kids. So that's probably been the biggest issue that group has surfaced.
And what are some of the proposed solutions in handling connectivity and trouble communicating with
I mean,
students?
we have a lot of access to the State Department of Education, to the commissioner herself, Charlene Russell Tucker, and to Desi Nesmith, who's the deputy commissioner. And so we're constantly bringing these issues to the forefront. Our office just filed an administrative formal complaint with the State Department of Education on special education issues for kids in Bridgeport because they have 19 special education vacancies. So how are they going to be able to deliver appropriate special education services when the teachers aren't even there? So there are a lot of different avenues that we take for advocacy to try to address the issues with the State Department of Ed, with the Hartford school superintendent, etc.
Switching to another group of children that desperately need advocacy, there are over 100,000 immigrants in the state of Connecticut. A lot of them are children. How has your organization been able to provide for undocumented children who probably need advocacy more than other groups, to be honest, especially in the news right now where unaccompanied, undocumented children have recently taken over the news?
Yeah, so we do have an immigrant children's justice project with two attorneys, and we serve primarily, most of the kids are coming through Fairfield County initially. So that is where we've concentrated most of the efforts, although we will take some kids from some of the other counties in the state. But we do represent immigrant children, undocumented kids. We have a pro bono project where we train attorneys to help us. Right now, even with the pro bono project that we have a waiting list of kids waiting for legal services. That's just to file in probate court what they call a special immigrant juvenile status. Then once you get that status, and you show that you're both been abused or neglected in your home country and it's too dangerous to go back, then once you get that finding in probate court, you need to go to the actual immigration court and try to get legal status to stay in this country. And we are expecting potentially an influx as a result of what's happening right now at the border. So we already have a waiting list. So I am concerned. Right now, kids that don't even get to us and they have to go to immigration court directly, they have no legal representation. Attorneys are not required. So you have babies and 17-year-olds without legal representation in immigration court. It's a huge need.
One of the most jarring images I remember during the Trump administration was this recreation of a 3-year-old child having to defend themselves in court. It is jarring, it's disturbing, and the fact that lawyers are not required to be present is is disheartening and heartbreaking, to be honest. In your opinion, I know I've said a lot, but in your opinion, how is this legal, and what can be done to advocate for these children? I mean, there's so many, and each of them deserve a fair chance to get into this country.
Yeah, no, I totally agree with you. I think it's more than heartbreaking. I think it's unacceptable. And we have proposed state legislation in the last couple of years to try to correct that. The state could provide legal services for undocumented kids in immigration court. So it can be corrected if the legislature found its way to try to do that. But I think it's just unacceptable that kids go to immigration court without attorneys.
How did we even get to that precedent is the question that still baffles me to this day. Um, during is there anything that can be done legally to and I know that we are in Connecticut, we're not at the border, but is there anything that can be done to help children that are unaccompanied and children who are undocumented through your organization?
Yeah, well, first of all, we do have this project, right? So if people are interested, they can donate to the project, or they can, even honestly donate food cards. I mean, when the pandemic started, we were going out to Stop and Shop and buying $1,000 worth of food cards because the kids in that situation didn't have access, because you can't, no access to health care unless it's an emergency, and no access to benefits. So it was really, that group is really disempowered. People can advocate with their legislators to pass a bill to require attorneys. And then if anybody is an attorney listening to this, they can sign up to get trained in our pro bono project to actually represent kids.
We only have a little bit of time, but I did want to ask one question. You have a program called the Medical Legal Partnership that provides advocacy for children's health, and it's very important during this time. Can you tell us a bit about it? And again, what are the biggest challenges you faced during this time?
Sure. It was a program that I actually started about 20 years ago. There had been a similar program in Boston, and I went to the chair of pediatrics at Connecticut Children's and said, we need to put an attorney inside your hospital. And he said, no, attorneys don't like doctors, and doctors don't like attorneys. So I said, oh, we can get over that. So he actually agreed, and we started the second in the country of a medical legal partnership project. And it grew from there. And so we have now an attorney representing kids at Charter Oak, at Bergdorf, at CCMC, and now at Yale New Haven Hospital. And just most recently, we put an attorney inside Yale Child Study Center, which deals with the mental health issues for kids. And a lot of the partnership is that the doctors and the social work staff from the hospital pick up social determinants of health that get in the way. For instance, give you an example, if a child is suffering from asthma and it turns out that the asthma is related to poor housing conditions, they'll refer us the case, and we will represent the kid and the family on the housing issues relating to poor conditions. Another example is when we represent kids on education issues. A lot of kids have disabilities, and the doctors and the medical staff will refer us cases in that area. Utility shutoff is a big issue that we represent. We have utility clinics. If anybody's listening, they can volunteer for our utility clinics to counsel families on how they can not have their utilities shut off. So they're different. It's a great partnership that we have with the medical community, and I think it really works.
Thank you for talking with us. It seems like almost everything is connected, isn't it? Um, Thank you
And
for.
one of the issues when I created the center was no stop shopping, right? One stop shopping. So I hate these organizations that say we don't do this and we don't do this and we don't do this. It's like whatever the issues are that the kids have, yeah, we'll do it because the kids are such at risk and the families are such at risk that all of the issues are interconnected.
Yeah. Yeah. Thank you very much for the work that you do, and thank you for speaking with us.
Sure, thanks for having me.
Have a great afternoon, Martha.
Thanks.
That's all the time we have. Thank you, Martha, for joining us this afternoon. Tune in next week for another episode, and don't forget to follow us on all of our social media handles on Twitter at CT Latino News and Instagram at CT_Latino News. I'm Savani Campos with CTLN Opinion Plus. See you next time.